Tom, I just saw your video with Mark Hyman, and I was looking at things and trying to understand your process. Look, create, believe, create. And I'm from India. I came here in '97. My goal was to create a self-sustaining healthcare system in India. So the goal is to, cost is a factor in everything, and adversity has to be a step up for everything. So innovation, like you said, major problem is communication, personalization, realization, implementation, and reevaluation. So to do that, we have to innovate and create a patient-centric approach. We're talking population health, that is great, but the real care happens at power of one. So we need to use technology and processes. Say, for example, if you have deaths and disasters happening, deaths from, say, cancer is a certain number, but more than that, cancer and HIV, it is diabetic foot amputation. So that cannot happen without personal approach. So innovation is key. Yes, vaccines are great. We need to work on it, but how is the real solution for end users, empowering them happening? I mean, innovation, like you have that thing, Mahatma Gandhi said, you have to create the future you want to see. If this is a challenge, let's raise up to it. Let's innovate. Let's convert this mass medicine mindset of M3 medicine to power of one approach. Let's think, let's collaborate, let's create a platform-based approach that takes this knowledge and brings it to a solution that empowers each person to improve and track the data and improve, help them improve themselves. At the end of the day, it just comes down to food addiction, metabolic health. This society needs to focus on metabolic health optimization for every person, everywhere. So what do you say on it?
Thank you. So you moved to the US in '97, I moved to India in '96. Happy Diwali, a few days late. I think the platform is primary health care. I think this is where the puck is going. Now, I don't think it'll look like primary health care today. I am certain that artificial intelligence will transform medicine. It can do that in good ways, it can do that in not so good ways. But if we look at primary health care, and I address this in some detail in my book, The Formula for Better Health, it's not weak because primary care doctors aren't smart. It's not weak because we don't have a verbal commitment to primary health care. It's weak because our economic structure of health care determines that it would be weak. By one estimate, we spend currently less than 5% of Medicare dollars on primary care. If we tripled that and did it right, we would reduce overall Medicare expenditures. So looking at the two main drivers, the economic incentives in the system, and I don't mean incentives for specific indicators. I mean having a structure like Kaiser Permanente, where if the health system does better and keeps people healthier, it makes more money. And if it does worse and more people get hospitalized preventably, it makes less money. That's a structural intervention. With that approach, and that doesn't have to be Democratic or Republican, I think that's about good government, good management. We can see a much stronger primary care system, and I do think artificial intelligence carries within it some enormous potential for transformation. When it comes to monitoring, we really don't do a good job of monitoring health, and that's one of the things that's very much at risk, to see whether programs are really succeeding. And that means empowering the healthcare workers to know how they're doing and to do better.